Health Benefits Committee, Pension and Health Benefits Committee meeting to order. The first order of business will be to call the roll, please.
Rob Fechner.
Good morning.
Ramon Rubalcaba.
Here.
Margaret Brown.
Here.
Henry Jones.
Here.
David Miller.
Here.
Ralph Cobb for Arena Ortega. Here. Mona Pascal Rogers. Here. Teresa Taylor. Here. Karen Green Ross for Betty Yee.
Here.
Thank you. Please note also Mr. Perez joining the committee this morning. Second order of business will be approval of the May 14th meeting timed agenda. What's the pleasure of the committee?
Second.
Who moved? Moved by Taylor, seconded by Pascal Rogers. Any discussion on the motion? Seeing none, all in favor say aye.
Aye.
Opposed, no. Motion carries. Before we move on, I want to take a moment of personal privilege and call on Mr. Perez. If you could push your button, please, sir. Thank you. Mr. Perez.
Good morning. I'm in uniform this morning with a morning band over my badge. In 1962, President JFK made May 15th National Police Officer Memorial Day. This whole week is National Police Officer Memorial Week. Last year, the United States lost 158 men and women while they're protecting their communities, and in California, we lost 10. One of the 10 was a dear friend and a CHP officer, a good Christian man, and I'm going to miss him. Thank you.
Thank you. And thank you and all of the men and women of law enforcement for what you do every day. Thank you very much. Agenda item 3, executive report. Ms. Lum, Ms. Bailey-Cremens, please.
Good morning, Mr. Chair, members of the committee, Donna Lum, CalPERS team member. I've got 2 very brief updates to share with you this morning. I know that we've got a full agenda, so I'll keep my remarks brief. First and foremost, I'm very happy to share with you that after 5 years at various locations, including Rancho Cordova and West Sacramento, our customer service and outreach division, which consists of our regional offices who are in their location, but our contact center and our education and a training team who has been in West Sacramento have moved here to the headquarters campus. Nearly 300 team members moved from their recent location in West Sacramento to both our Lincoln Plaza East and Lincoln Plaza West buildings. And the contact center moved yesterday. Due to the relocation, we did modify our hours of operations. However, I am pleased to share with you that as of this morning, we are back to serving all of our customers during our normal business hours. The move was very, very smooth. We did not experience any issues. A few minor things with headsets. That's to be expected when you have over 200 agents who have new phones that are being placed in a new location. But certainly all the planning that took place over the past year really paid off in making this transition very smooth. Just to note that a move of this magnitude does require extensive coordination and collaboration. And so I do want to take a moment to thank all of the team in the Customer Service and Outreach Division, the Operations Support and Services Division, and the Information Technology Support Branch. They have been wonderful partners with us, and as I mentioned, over the last year, there's been a lot of planning that has been underway to make this move happen. We're very happy and excited to have the team rejoin us here at headquarters. And as you can imagine, as I mentioned earlier, we've been in multiple locations. Having everyone here on campus does help to promote camaraderie, collaboration. It does reduce the cost as we are no longer having to rent the space in West Sacramento at that facility. And most importantly, it does strengthen the service that we provide to our customers because we have all of our team members here in the front office and the back office, and it makes the transactions much more seamless. So again, just welcoming all of the team and letting you know that we're all here. We're all back at home. Next, I'd like to turn to CB update, which I normally do in my executive update. We do have 2 CBs that are scheduled to take place in June. The first is in San Ramon, and it's on June 7th and 8th. And although this event is still 4 weeks away, I'm happy to share with you that we already have 1,750 members that have pre-registered. Now, we do expect, as we have with our previous CBs, to break our previous records. The last time we were in the South San Francisco area was in 2017, and we had 1,300 attendees. So again, we're at 1,750. We have 4 weeks to go, but I can assure you that our teams are very well prepared for whatever size of attendees that we get at this event. And then the second one is scheduled for June 14th and 15th, and we'll be hosting that CB in Pasadena. This CB is 5 weeks away, and again, we already have over 1,800 members who are pre-registered. The last time we were in Pasadena, it was in 2017, and we had 1,450. So we're nearly close to 400 pre-registered members, and again, we've got another 5 weeks. So again, we're planning for the large size of the attendees that we've been seeing. And always, if you're in either of those two areas, we welcome you to join us. I do know that the team members and our members that are at the events do enjoy seeing you, interacting with you. And as we've talked about in the past, there is much to be said about the education that is occurring at these events, and we are seeing a lot of positive impact. We do have many members that are coming into our regional offices having mentioned that they've been to a CB, and they appear to be much better prepared to sit down and have the conversation and dialogue about their readiness for retirement. Mr. Chair, that does end my comments, and I'm available to answer any questions you may have.
Well, thank you. Seeing no questions, I will say that maybe not the same reaction as some parental units, but this body appreciates having the whole family back at home. So thank you to the customer service folks for the time they spent away, but we're glad to have them back here. Ms. Bailey-Crimmins.
Good morning, Mr. Chair and members of the committee. Leanna Bailey-Crimmins, CalPERS team member. For my opening remarks, I have 2 highlights. The first is I'm excited to share with you the launch of the new CalPERS Health Plan Events and Resources webpage. It's a great year-round resource for our members. It gives them opportunities to participate in fun and healthy community activities sponsored by the CalPERS health plans. And then second, I will highlight the Pension Health Benefits Committee and what to expect from today's agenda. So taking the first steps towards improving health and wellness often includes searching for information or looking for classes. And so I'm proud that CalPERS now has a unique online resource tool to make finding that information much easier. This is a one-stop health events experience, and it's located on our CalPERS website at www.calpers.ca.gov. On that main webpage, you'll see I Want To, view health plan rates, and then simply click on Wellness and Events link, which is approximately about halfway down that page. Once there, our members can click on the plans they're interested in. So for example, if people weren't aware, downtown Sacramento, there are free yoga, Pilates, and free Walk to Thrive clubs. All of these events are open to the community. And so regardless of which plans our members are signed up with, they can attend these community events with their family and friends and neighbors. So I hope that both our members and the community gets more information by encouraging them go to this new this location on our website and find out all the new exciting wellness tools and hopefully participate in some of the healthy activities listed. And so for the Pension Health Benefits Committee today, we have 3 agenda items. The first is an information consent item, which highlights the annual CalPERS Health Plan Trend Report. This report is a high-level summary and includes membership migration statistics. It also shows 8 of the most significant utilized services and the costs associated with those services. So for example, the number of prescription days our members were on medication went down by 3.2%. Great number. But the overall unit price for prescriptions went up 10.8%. And so that CalPERS Health Program uses these types of indicators to meet with the plans quarterly during our meeting reviews and also annually during rate negotiations. All of this in order to provide our members the best quality of service at the most affordable price. For action today, staff will be recommending to use $44 million of our PPO excess reserves to spend down the CalPERS PERS Care premium for 2020. This aligns with the board's reserve policy, which was adopted last year in 2018. And so for information item, we will be publishing the preliminary rates Keyword preliminary. Between now, May and June, we will continue to negotiate with the plans to have a positive movement before the final 2020 rates are approved by this board in June. And lastly, I'd like to take a moment of privilege, and I'd like to personally thank Ms. Kim Mom for joining the CalPERS Health Program as the interim chief of the Health Policy Research Division. She's leading the rate negotiations. As many of you know, she's a tough negotiator, and will continue to provide leadership and assistance to the health program as we fill this vacancy permanently. With that, Mr. Chair, this concludes my opening remarks, and I am available for any questions.
Thank you. Seeing no questions, we'll move on to agenda item 4, which is the approval of the April 16th committee meeting minutes. What's the pleasure of the committee? Moved by Jones, seconded by Taylor. Any discussion on the motion? Seeing none, all in favor say aye. Aye. Opposed, no. Motion carries. Agenda item 5 is the information consent items. Having no request to move everything off of the consent, we move to agenda item 6A, the use of preferred provider organization plan reserves. Ms. Donison.
Thank you, Mr. Chair, members of the committee. Kathy Donison, CalPERS team member. This is agenda item 6A, and it is an action item. And we recommend as a team that the Pension and Health Benefits Committee approve the $44 million proposal to apply excess reserves to reduce the 2020 PERS Care Basic Premium. In September 2018, this board approved a revised health care fund reserve policy. The policy in part updated the level of the PPO plan reserve, established the criteria for reducing or increasing a PPO plan's reserve when predetermined thresholds are met, and adopted a methodology for handling any surpluses or deficits attributable to the PPO plans. In the past, the board has used additional reserves to mitigate PPO basic and Medicare supplement plan premium rate increases. The healthcare fund reserve includes the pharmacy component at $116 million, and this is as of December 31st, 2018. The medical component at $386 million for a total prudent reserve of $501 million. But currently there is an extra or excess $84 million in the basic and Medicare PPO accounts. The 3 basic plans, PERS Care, PERS Select, and PERS Choice, and the Medicare plans, the supplements for PERS Care, Medicare Choice, and Select. The $84 million comes from the reduction of the risk-based capital from 300 to 250 in accordance with the reserve policy that was adopted. And it resides, as you see in the bar above, across all of the basic and Medicare PPO plans. For this month, the published premiums for May have been displayed. There's a 0% increase for PERS Select, and these are approximates, 4.8% for PERS Choice, and 23.9% for PERS Care. The significant 2020 PERS Care basic plan premium rate increase is due mostly to ending risk adjustment beginning in the 2019 plan year and transitioning the plan to reflect its actual cost. Last year, the board approved the use of $46 million to impact the 2019 PERS Care basic plan premium rate caused by the elimination of risk adjustment. In 2019, instead of a 38% premium increase, the 2019 PERS Care basic plan premium increase was 19%. For this 2020 PPO PERS Care rate, the board may use $44 million of the $84 million surplus reserve to decrease the projected 23.9% increase to 9.4% increase. And that is the team's recommendation. The recommendation only asks you to spend the $44 million. And we ask you to adopt this recommendation today.
Move approval.
Well, we have other people who want to speak first. Anything else, Ms. Donison?
At your pleasure, Mr. Chair, I can either finish the presentation.
Please do.
Thank you. The next steps are to finalize the 2020 premiums in June and use the $44 million to reduce the PERS care premium. Now, over the next year, the team will look specifically at the PPO Basic and Medicare plan data, including but not limited to member migration patterns, plan design, member purchasing preferences, and focused outreach to stakeholders to formulate recommendations for the board's consideration of the future of our PERS care, PERS choice plans. And this is very similar to the approach we did in redesigning the PERS Select plan to become a value-based insurance design, which is now yielding very positive results. This is an action item, and we request that the board accept the team's recommendation to spend the $44 million of healthcare fund excess reserve and apply it to the PERS care premium for 2020. This concludes my presentation, and I'm happy to answer any questions.
Thank you. First request, Ms. Taylor.
Yes, thank you, Ms. Donaldson, for the presentation. I am kind of looking at some concerns from some of our members. I'm looking at a letter right now. So, and I guess I'm a little concerned that we bought down rates last year for the PERS care, and we still have some more adjustments to do because of the getting rid of the risk adjusting. And I know you're going to be looking at specifics. I guess my concern is, are we going to see it trending down? Because it went from 38 to 23, and I'm hoping this trend continues to go down, because otherwise it doesn't seem sustainable to have a plan that's our self-funded plan that keeps going up double digits. So.
Thank you, Ms. Taylor. Our expectation is first by June, this 23% that you see today will most likely be lower as we get additional claims. However, that may not be the case. So
Right.
This is a percentage increase as of what we see today.
Right.
And so by June, it could be trending down even further.
Hopefully.
Yes, and so by taking it down from 23 to the 9.4%, we believe that we will look at it again next year, but remember that we would look at the 9.4% and then look at what the trend would be for 2021 in terms of getting to the 2021 rate. We do believe that it is moving faster to the true cost of care than perhaps what we projected, but we won't know until we actually start to see the rest of this year's claims experience going into next year's claims
And then it should be
experience.
better for 2021 when we're doing the rates for 2020.
I would expect that we're going to continue to kind of regress to the mean, to the actual cost of care.
Because it looks like we're at cost of care for the other two plans.
Correct.
Someone's concern here was that maybe we should, they called it a dying plan. I don't necessarily agree with that, but their concern was maybe we should be buying down the 4%, rather than putting it all on this. But I just, what would be your recommendation there?
Well, I'd like to talk about 2013, when it had reached a point and when it did look like I don't want to call it a dying plan, but certainly there was a concern for, in insurance term, is death spiral. At that time, we didn't really understand who was buying the plan, who was in the plan, why were they purchasing. It was still a much higher cost plan compared to the other two. This is our opportunity to say to ourselves, let's spend the next year seeing who's in the plan, what is a benefit design that could be more consistent with people selecting this plan, and really maybe query our stakeholders about.
That's a good idea.
About why are they in the plan and what do they think the future should be for the plan.
That's a very good idea. All right. Thank you very much.
Thank you. Ms. Brown.
Thank you, Mr. Chair. Can you tell us how many total covered lives are in the PERS care, and then how many shifted from last year when we had the huge 19% increase?
We currently, as of January 1st, in the basic plan, have about 149,000 in PERS Choice. PERS Select now is about 70,000. They gained about 20,000 members, but the interesting thing about that 20,000, they came from all of our plans. They came from other HMOs and even from the association plans. And then for PERS Care, as of January 1, it's about $32,000. For the supplement plans, PERS Choice is about $72,000, Select around $2,100, and again, PERS Care Supplement about $63,000.
And do we know how many we lost, how many transitioned from PERS Care last year because of the increase in the rates? Just approximately 10%?
I'm going to turn to some of the numbers, folks. 8,500 approximately.
Oh, okay. Not too many, with considering what a huge increase that is, and so I might assume that they really want the 90/10 PERS Care plan, and so I do agree with staff that applying the $44 million for the folks that want a one-time for the PERS Care to help buy down that premium, I think is a great reason, and gives you the year to understand what our members truly need. So saying that, I'd like to move approval for staff recommendation.
Been moved by Brown, seconded by Taylor. Any discussion on the motion? Well, before we actually vote on the motion, we have a, pardon?
He's got it.
I'm almost there.
He's got it.
You want to change seats? So before we act on the motion, I have 3 requests to speak from the audience, if you'd let me to finish. First, we have Mr. Robinson, Mr. Behrens, and Mr. Woodson. Please come forward. Give your name and affiliation for the record, and you'll have up to 3 minutes for comment.
Thank you, Chairman Fechner.
Yes, sir.
Members of the committee. Tim Behrens, President of the California State Retirees. We applaud the health team's recommendation to you to recommend to the board to spend that $44 million and spend down the percentage. We would like to encourage you to consider putting the whole $84 million in, and you'd still have $501 million in reserves. And that would even bring it down farther. My rationale for that is we have several stakeholders that live in very remote areas, and they only have one choice. So that one choice may be one of the reasons that some of those people didn't migrate last time, because they can only get that particular carrier in their area. So I would encourage you to consider that. Then I wanted to thank the CalPERS health team for doing a presentation on mental health services. They had all of the insurance carriers in the room at the same time, and we did about a 2-hour discussion, and was very informative. And it feels like for the first time, mental health is getting a much more looked at look by the insurance carriers. And in fact, up in Paradise, where the fires were, I understand that the first responders are getting a lot of help, as are all of the people that responded in or lost their homes and all of their belongings. Thank you.
Great. Thank you for your comments. Mr. Woodson.
Good morning. Larry Woodson, California State Retirees. Thank you for the opportunity to comment, Mr. Chair and members of the committee. The staff recommendations to allocate the $44 million out of $84 million of what is called the PPO surplus to lower PERS Care premium to 9.4% is, well, there seems to be an implication that this is really generous and that the 9.4% will have little impact on retirees. And I ask the board to look at the bigger picture here, particularly the new board members that weren't here in December of 2017 when abandonment of risk adjustment occurred. And by the way, we brought this up before, but it occurred in closed session with no notice or opportunity for public comment. And the rates of PERS Care premiums increased that year an average of 20%. And by the way, I got calls from people that had much higher increases than that. And so the basic plan members just couldn't afford those kind of increases, had to migrate to what I would say are inferior plans, which only pay 80% instead of 90%, and had higher maximum caps. It should also be noted that 18 counties have no HMO basic plans available, so they're forced into the PPO plans. adding 9% premium increases to the already 20% from last year is really a hardship to members on that plan, and they're on there for a reason. I'm one of them. There is an easy solution. As Mr. Barron's commented, CSR strongly suggests including all of the surplus for this purpose, which would actually result in a slight decrease in PERS care premium for last year. By my calculations, it is a surplus, and it should be returned to the members and not have those members affected by such a large cost increase. There's already $501 million left in the total reserve, and that's a huge percentage of the total costs. If you look at the costs of the medical costs and the drug costs combined, it's a huge percentage. If the governor proposed that kind of a surplus in his budget, he'd be recalled. So please have the staff reconsider that $44 million and increasing it to the $84 million or close to it to minimize the impacts and hardships on our members. Thank you.
Thank you. Mr. Robinson.
Good morning. Harvey Robinson, RPEA, Director of Health Benefits. We would like to recommend that it reduce any premium rate increases for the individual PPO plans that generated them, not just PERS Care. Essentially, CalPERS staff recommendation is a rate adjustment paid at the expense of the other PPO plans to maintain this very benefit-rich CalPERS basic health plan. The recommendation to continue to subsidize the CalPERS basic health plan is at the detriment of other PPO health plan members who should instead benefit from the excess reserves in the form of premiums later on to the PPO plans. Members and employers should not be forced to forgo premium reductions at the expense of one ongoing ailing health plan. Significant number of CalPERS health plan members and retirees are from local agencies and schools who do not enjoy a full or significant portion of their health and Medicare premiums paid by their employers. Many of these employers have been required to scale back their health plan contributions in order to pay for increasing pension obligation. CalPERS should consider addressing the systematic and long-term problems within the CalPERS basic health plans to stop the bleeding. Perhaps a risk adjustment should be made to reduce the richness of the plan. Please stop forcing the members of other PPO plans, including those in Medicare PPO plans, to keep subsidizing the PERS Care basic plan. Thank you.
Thank you. Ms. Bailey-Crimmins, Ms. Donison, any comments? Okay. What would, if we were to listen to that concept, what would that do to the rates next year if we were to increase the funding?
If, Mr. Fechner, if we took the entire $84 million and applied into a single year, in the insurance business, what we call that is a snapback. Our goal is to try to smooth the rate of where we get to the true cost of care for the PERS Care product. And so if we use the entire amount, we would reduce it to the amount that we heard, but then it would then take that number and then multiply and then be added to what it should be just based on the industry and claims. So you'd see maybe even a higher increase next year. So this allows us to smooth, it allows the team to have a full year of analysis, getting stakeholder input, and be able to provide the committee and ultimately the board a recommendation on really what the next few years should look like when it comes to our PPOs.
So in essence, lack of a better term, it'd be a false sense of security for this year, and next year they could get double what they have now.
That is correct.
Thank you. Ms. Brown.
Thank you. Ms. Bailey-Crimmins, I want to make sure that people understand what your goal here is. And your goal is to have no excess reserves, to come up exactly even. Is that not correct?
So, so there's two things. The reserve itself is a month and a half. It sounds like it's a big number when you run a $9.3 billion. It's a month and a half of reserves. If there is a new pharmacy drug that comes out, we have a month and a half reserves that then can cover that additional cost. Excess is where we collect either rebates or, and we try. I mean, we get federal subsidies, and we're always trying to navigate. It would be ideal, Ms. Brown, if I could get it down to the penny, but I don't see that ever necessarily being the actual case, but that would be the ideal.
I'd like to add one more thing to that. We don't know what the pharmacy space is going to look like next year. We are recommending a prudent expenditure, not the whole expenditure, because next year, with all the changes in the pharmacy market, we don't know yet what that might look like. And so the $44 million is a prudent estimate of what would keep us actually with the ability to look at what 2021 might look like in terms of higher claims or higher pharmacy costs.
Thank you.
Very good. Thank you. No other requests to speak. A motion being before you. All in favor say aye. Aye. Opposed, no. Motion carries. Thank you. Brings us to information agenda items, starting with 7A, preliminary health rates. Ms. Malm.
Well, my speech says good afternoon, but I'm pleased to say good morning. Chair, members of the Pension Benefit or Health Benefits Committee, Kim Malm, CalPERS team member. Agenda item 7A presents the preliminary health premiums for 2020. The premium sheets have been provided to you as a handout. They are also in the back of the room, and they've also been posted to our website. Here's a look at our timeline. The rate development process began back in January, where we had our official kickoff to the rate setting process. May now marks the release of the preliminary health premiums. CalPERS rate teams will continue to analyze the premiums submitted by the health plans to ensure accuracy and affordability as we prepare final 2020 premiums for approval by the committee in June. This is the first time the health plans see each other's rates, which leads to some healthy negotiations. It's also the first time members, employers, and stakeholders see the plan premiums. Let me emphasize that these are preliminary premiums and will vary from the final premiums that will be presented to this committee again in June. Open enrollment will be September 9th through October 4th, and the new premiums will take effect January 1st, 2020. Let me touch on a few of the key highlights. First, there are no copay or benefit design changes to the health plans for 2020. For plan changes, Blue Shield is offering a new plan called Trio. It's a narrow network that will be offered in the following 6 counties: El Dorado, Los Angeles, Nevada, Placer, and Sacramento and Yolo. In addition, Anthem HMO Medicare Advantage is expanding into Monterey County for 2020 to provide an HMO coverage for our combination enrollment members. Let's go over what we're seeing as part of the May preliminary rates. There's an 8.03 weighted average increase to the basic HMO and PPO plans over 2019. There's a 2.11% weighted average increase to the Medicare plans, and an overall 7.24% increase for our total plan population. So why don't we turn to the HMO products first? I'll go over those plans that had the largest increases at this time. HealthNet Smart Care has the largest premium increase of over 2019-20 compared to the other health plans of 24.4%. The main reason for the large increase stems from Blue Shield's exit from the Bay Area. This exit added 10,000 additional lives to this plan in the most expensive area for healthcare, which is the Bay. In addition, 10,000 lives that migrated to this plan may be less healthy than the average CalPERS member. Blue Shield Access Plus has an increase of 16.1%. This plan has a high percentage of fee-for-service claims in comparison to the other HMO plans. We'll continue to evaluate this plan as fee-for-service claims data between now and June and validate that this rate is justifiable. And finally, United Healthcare It's had an increase of 11.4%. At this point, UC Davis seems to be having a substantial impact on UHC's statewide rate. We would like UHC to continue negotiating with UC Davis through May to June to see if they can drop the cost between the May and June final numbers. For HMO Medicare plans, we're seeing the following. Anthem HMO Traditional, 13.7% increase. Kaiser Medicare Advantage is a 1.2% increase, and United Healthcare is a 13.1% increase. Now, switching to the PPOs, we have a 4.8% increase in PERS Choice, a rate pass for PERS Select, and a 9.4% increase for PERS Care, with the spend down that Kathy just discussed. The projected 2020 rate pass is partially the result of improved health risk in 2019 and the introduction of the value-based insurance design, or VBID. For the 3 PPO Medicare plans, they're projected to have less than a 1% rate increase in 2020. This is mainly due to the improvement in pharmacy rebates and employer group waiver program subsidy projections for 2020. The rates team will continue to consult with external and internal actuaries to provide independent consultation, objective assessments of each proposal from the carriers, and comparison with market trends. Obviously, our goal is to get the best value for our members. Let me touch base for a minute on the public agency and school regions. I'd like to remind the committee that in December 2018, the board approved the change the structure of the regions for public agencies and schools from 5 regions to a 3-region model. This is effective for the 2020 rates. Attachment 3 provides a map of both the current 5-region and the 3-region model. So for our next steps, we will, between now and June, we'll continue negotiations with the health plans. We'll continue our analysis of the claims and refresh data by the plans. The premiums will be validated by a third-party actuarial consulting firm and our internal teams. We'll bring final health plans and premiums to you in June for approval. We'll then prepare again for open enrollment and the implementation of these rates, January 1st, 2020. This concludes my presentation, Mr. Chair. I'm happy to take any questions.
Thank you, Ms. Malm. And I'm going to start out by saying, and sadly, we seem to say this every year, but it feels like I'm back in 3rd grade at times when we're not progressing from year to year. It's time for everybody to sharpen their pencils. No matter which plan you're with, the pencils need to be more sharp. Our members are directly affected by any increase. State employees have a formula. Most schools and public agencies do not have a formula. Most of them have caps on their medical. So that means any increase coming from the vendors goes directly to the pockets of the members, not to the employer. So please keep that in mind as you think about that, because our members will at some point start shifting the lowest cost plan they can find. And it comes down to, the end of the day, it comes down to their pocketbook. And they have to make decisions based upon that, and they're going to. So please keep that in mind as you go forward. Make the best decisions you can that help our members. We want to all be team players and work together with each other. But at the end of the day, we're here to support our members. And we hope that you're going to do the same. Ms. Taylor.
Oh, thank you. So, as you know, I'm not real happy with these rates either. I just wanted to also follow Mr. Fechner in saying that I think we need to, and I know you guys are going to, we need to go back and continue to negotiate. These rates are really high to me. Even the single-digit rate increases are relatively high compared to what we've seen before. I know what our costs, our cost trends are. I understand what they are, but I also think that we have room to move. So I think that our health plans really need to work at bringing those rates down. I spoke earlier about how I represent all state employees, and this does impact us directly in our paycheck. There is no question that when the very first thing I hear on January 1st is, oh my God, I can't afford this. So it's we have to do better. And I'm in agreement with Mr. Fechner. We do this every year. I've been on this board for 5 years. We've been trying to figure out ways to do our best to curb costs, but still have quality health care. And I'm asking that we also direct our health plans to do the same. It can't just be us trying to curb those costs while the health plans and the providers are not. So I appreciate that. Thank you.
Thank you. Mr. Jones.
Yeah, thank you, Mr. Chair. Yeah, I echo both Mr. Fechner and Ms. Taylor's comment that our members are reaching out to us and saying that they want affordable health care, and the voices are getting louder and louder. And we want to make sure that that voice is carried through to our plan sponsors, and you need to listen now because something will definitely have to happen. And if you don't act now, we don't know what will happen later. So we're reaching out to you now to sharpen those pencils and bring us back some rates that are affordable and that our members can live with.
Thank you. Ms. Green Ross.
Also, just, is it possible to understand if the current federal administration's decision to not pursue the Cadillac tax and the whole screwing up of the Affordable Care Act and what it really means, is that affecting this as well?
At this time, it does have a per member per month cost of $5 per person. So it is impacting it, but we're having those conversations still with the plans. And Leon is going to add to. We did that on purpose.
Okay, there you go. So it's specifically the $5 that Ms. Malm just mentioned is for the HIT tax, for the health insurance tax. The Cadillac tax, we're still looking at what's going on at the federal level. Unfortunately, the plans will not know if it applies to them till after our rates, and so we are going back and forth with them on what they should be including and charging as a part of our premium for 2020.
Okay.
Anything else, Ms. Green Ross?
Nope, thank you.
All right. So no other requests from the board. I do have a request from the audience. Mr. Woodson? Oh, Mr. Jones, there he is.
Yeah.
Go ahead.
Thank you. Yeah. Ms. Green Ross' comment raises a question about the Cadillac tax being known after the decision about the rates are determined. So what happens then? Is that a retroactive benefit during the course of the year, or is it just the impact is in the following year?
So Cadillac tax was delayed, let me just confirm with Ms., for 2 years, correct? So it's not applicable for 2020? Look at my expert there. So it is not, the Cadillac tax is not applicable. For the HIT tax, since they won't know until after, many of our plans did not include it. Others did, and so that is where we are from a negotiation point, making sure, because at the end of the day, if they get the bill from the IRS, the only way that they can pay it is if they've collected it via the premium. So we are making sure that they are able to meet their obligation if the federal government does make that decision, but doesn't do it at the high cost of overinflating our premiums.
But also ensuring that we're not giving them money for a bill that they have not received. Right.
Ms. Taylor.
So in addition to that, and I know I've asked this before, because the individual mandate is gone, because people don't have to buy health insurance through the ACA and get penalized if they don't, because of what they're trying to do to the ACA, I think I agree with Ms. Green Ross in that as health plans are having higher costs hit them over in the covered California, I think what I'm wondering then is, does that cost, and we'll never know, I'm sure, but do you feel that that cost gets passed on to private insurers?
Well, the benefit of CalPERS is in statute that our premiums must truly reflect the cost of care. Not all commercial buyers have that luxury, but because it's in statute. I'm not saying that there isn't cost shifting. We know there's Medicare, Medicaid, and commercial, and at some point the commercial makes, but I do want to do a plug. In July, we will have at the offsite a specialist that will come out and talk to us about what's going on and how those interact and how that cost shifting happens and what levers CalPERS has as we move forward in this unknown time to make sure that we can keep those rates affordable for our members.
Thank you. Mr. Woodson.
Good morning again. Larry Woodson, California State Retirees. First of all, I'd like to thank all the board members who just commented. I wanted to reiterate from a stakeholder standpoint that we think many of these rate increases are too high, and the sharpen the pencils analogy is a good one, and so we hope you're able to go back and bring these down. Just a kind of just a request in the future, since we get these plans the day of, these tables on preliminary rates the day of, it was very helpful when Ms. Malm gave the percentage increase in each one and went through that in her presentation. I'm wondering in the future if that could be an additional column for us, so we'd have a few more minutes to look at it and not have to do math, which I did. And so, finally, I guess it goes without saying that we have a for-profit healthcare system in this country and in California. And I think I've said this before, I always look at the Fortune 500 list of revenues and profits of these companies, and they're all doing pretty well. And so the rate setting is always, their profits are always figured into their rate setting, and I think they can absorb a little bit lower premiums on some of these plans. Thank you.
Thank you. And before I go to the next commenter, I just would like to reiterate what I said earlier for the plan's understanding. When I said employers have caps, my current employer has a cap of $350 a month max, regardless of the single or family. So do the math. You can see if it's a $1,200 premium, those members are paying $850 a month out of pocket. So anytime there's an increase, even if it's only $10, that affects them deeply. And education, as you know, is not funded correctly in this state. So those employees are a lot less paid than what we would like to imagine. So understand that hit when they get that rate increase each year. They're making decisions based upon their pocketbook. Ms. McCray. Please speak your name for the record, and you'll have up to 3 minutes.
Thank you so much. Hello, Chairman Fechner and members of the CalPERS board. My name is Crystal McCray. I'm an AGPA for the California Environmental Protection Agency, and I save taxpayers money by running a recycle and reuse store where people can come in and bring items that are gently used. I track them, and over the last 5 years, I've been able to save the state and the taxpayers over $1.5 million. I said that to say, as I move in, each year we know that CalPERS negotiates our healthcare premiums rates for the upcoming year. But our premiums have been rising much faster than the cost of living. Over the past few months, we have been in conversation with our members. We've heard over 600 stories from members who are suffering from economic insecurity and the rising cost of health care. I shared some of those stories with you and the audience today. We come before you today to request that you continue negotiating with healthcare companies to find a way to keep the cost increases to a minimum. And I hear what you've been saying today, and I support what you're saying. Ask these healthcare companies to do the right thing and not pass these high costs on to our members. The stories that I shared today, I can't get them out of my mind. The one that talked about a gentleman who, after he pays his rent and healthcare costs, has nothing left. Or the woman who put off mental health care therapy because she can't afford copays. That's unbelievable. That's human. As a strong member-led union, SEIU Local 1000, we're standing up to say, don't raise our rates. We join all workers of California that are fighting back against out-of-control increases in healthcare premiums while the CEOs are earning millions of dollars. California's working families deserve to be provided every opportunity to have quality, affordable health care. By standing together in collaboration, CalPERS and SEIU Local 1000 have the capability to have a profound effect on the entire state of California, just like I do by running a small recycle and reuse store and giving people the opportunity to reuse pencils. We can do this. Please stand with us today and help negotiate affordable health care rates. And CalPERS Board, please know we support you 100% in your efforts of trying to get our members what they need: quality, affordable health care. Thank you so much. We appreciate your time.
Thank you for your comments. Anything else, Ms. Mom? I want to, if not, then I want to personally thank the healthcare staff for all the hard work so far, but unfortunately, there's a deep dive still to come. So we thank you for your continued effort, and we look forward to seeing what you can come up with in June.
Thank you so much.
Thank you. Brings us to agenda item 7B, summary of committee direction. Ms. Bailey Crimmins.
Mr. Chair, I have no board direction at this time.
That's always good to hear. Item 7C is public comment. I have no request from the public to speak. Is anyone that did not put in a card wish to speak to the board at this time? Seeing none, this meeting is adjourned. Finance, what? What time? Okay, so what, 1 o'clock? Finance will start at 1 o'clock.